Hi, I'm Dr. Moore with New Life Physicians, and today we're going to talk about bioidentical hormone replacement therapy. I have been doing bioidentical hormone replacement therapy since 2005, and I have was the first one here in Middle Tennessee to start doing the pellet therapy with testosterone and estrogen that goes under the skin fairly painlessly and gives a very steady, even result with hormones. Whereas some of the other options can or might give you more of a roller coaster effect with hormones, the pellets will give you a more sustained, it kind of like goes up and then sustains a level of evenness where there's not a lot of ups and downs, and which is beneficial for both men and women. So I've been treating men and women for 10 years, and initially my practice was majority of them were women, and then they dragged their husbands in after they were feeling better. And now it's getting to the point where they're starting to catch up with the men. The men are starting to catch up with the women, and it's probably maybe 70-30 now, where it probably was 95 to 5%. I feel like after over 10 years, I've just really been able to hone in on doing this as safe and the best way possible with how I'm dosing and what interval people come in. And typically a woman will come in every 3 to 4 months, and a man every 5 to 6. I can tell you that it's more likely to be 5 for a man rather than 6, and maybe 3.5, 4 for a woman. But it depends on what kind of stress they're under or what kind of personality they have, because some people just will burn through that faster than others. So what is bioidentical hormone replacement therapy? Bioidentical hormones are hormones that are identical to what we're producing in our own body. And they've been made into a pellet form from plants, whether it's wild yam or soy. And it goes through a chemical process, so it's not technically natural, because I can't put wild yam or soy underneath your skin and you're able to convert it to testosterone or estrogen. Your body's just not capable of doing that. So it does have to go through a chemical process, and in the end, it's identical to what your own body would produce. It also has stearic acid in there, and the only reason the stearic acid is in there is to actually be able to get the pellet out of the mold that's where it's sterilized at the compounding pharmacy. And we do use a very reputable, one of the most reputable compounding pharmacies in the United States, and every batch is sent for testing to make sure that it's sterile, it's what it says it is, etc. So feel very, very comfortable with the pellets that we use. So the pellets then are made from the wild yam or soy and made into pellets. And then the pellets go into your skin, into the subcutaneous tissues, and it's released into your body gradually over time. It's kind of like having a hormone dispenser in your body. And so as blood goes past those pellets, it picks up the pellets, at the pace that it needs. And I can tell you that honestly, after 10 years of doing this, that it's clear that the body definitely has a part in deciding how much it takes, because over time, women often will not take as much estrogen as they take. They'll go through the testosterone a lot faster than the estrogen. So a lot of times I may not even need to give any estrogen because your body just doesn't need it. So it's kind of said, I'm good. And we're very adamant about checking blood levels after your implant and before your implant to make sure that that's the right thing to do, and that it's that your body's ready for it, and that we're not going to put too much in. So how do we put the pellets in? Well, we numb you up, and that's relatively painless. And then we use a trocar and put it underneath the subcutaneous tissues, and that procedure takes very little time, less than a minute with a woman. It takes a little longer with a man because they get so many more pellets than women do. And most people are, by the time I'm done, they don't realize I've already started. So they're surprised. They're like, oh, you're already done? Yeah, it's pretty easy. So women and men who often just feel very poorly, and they've been to their doctor and they've been to all their specialists, and no one can find out what's wrong with them. And so they are kind of left feeling like, what do I do? I mean, I feel miserable. And as an internist, I remember thinking, well, I just don't have a pill for I don't feel good. And it's just something that you just couldn't put a finger on. You're like, I've checked all the labs, I've checked everything I could think of to why you might not be feeling well, and don't find anything. And so our natural reaction is like, well, we got to fix something, so we'll put you on an antidepressant. That's sort of the traditional doctors, and I'm not blaming them, but because that's all they have at their disposal is giving an antidepressant. Well, sometimes that might help, but oftentimes it doesn't help with your testosterone levels. It doesn't help with your estrogen levels, and it just kind of might mask some of those symptoms. So with the pellets, you can get your life back, and you don't have to be miserable. You don't have to live like that. There's no reason for you to keep on going, feeling like you're, just don't have anything left, to give. You have a hard time working, you don't want to be social anymore, and your relationships are starting to suffer. You don't have to have that anymore. Your life can be changed around, and you can get it back. Is this everybody's answer? No. But the majority of the time, when people do have the symptoms that are consistent with their hormones being off and not in balance, this does help. And, you always want to do that in conjunction with exercise, eating well, having a good, healthy spiritual life. And that put together, when you're doing, addressing every part of your being, then you can start having a healthy, happy experience in life. And I'd love to help you if you're having problems with that and you feel like you just haven't gotten any answers anywhere else that you've gone or looked. Come see me and let's talk about what's going on with you, and we'll find out if this might be right for you. I appreciate your time, and if you'd like to have a consultation, I encourage you to go to the website and learn more, or call us at 615-771-8832, and we'll be happy to help you. Thank you for your time.